very special Global Handwashing Day webinar being organized by the Water Supply Sanitation Collaborative Council in partnership with the Global Interfaith WASH Alliance. And we are so thrilled to share with you that this year's Global Handwashing Day theme is hand hygiene for all. And in these times of COVID-19, the simple act of hand washing has become critical in ensuring our cleanliness and ensuring our health. So without further ado, I'd love to introduce our diverse and rich panel of speakers in just a short summary of everyone's name, and then we will do proper introductions as they speak throughout the panel, and you'll have a beautiful, beautiful panel of speakers from international organizations as well as national organizations. We've got with us a very special message from our Honorable Health and Family Welfare Minister, Dr. Vardhan, and we've got with us His Holiness Pujya Swami Chidanand Saraswatiji, who is the founder and chair of the Global Interfaith WASH Alliance. We'll be joined in a little while by Dr. Saumya Swaminathan, who is the chief scientist of the World Health Organization, and she's joining us from Geneva. We will also be joined by Dr. Yasmin Haque, who is the UNICEF representative in India. And then we have with us the UNFPA head, Argentina, who's also joining us. Miss Argentina, a warm welcome. And Dr. Yasmin, a warm welcome to you as well. Thank you so much for joining us. We have with us the Secretary General of the Global Interfaith WASH Alliance, Sadhvi Bhagawati Saraswatiji, as well as the country coordinator of UN volunteers, Shri Arun Sahdeo. We have Vinod Mishraji, who is heading the India WSSCC wing here in India, and Father Paul, who's the executive director of Caritas India. We have Haji Salman Chishtiji, who's joining us from Ajmer Sharif, and beautiful messages from other faith leaders, which will be playing towards the end of the webinar to show you the diversity of the messages that have come in today. And with that, I'd like to invite my colleague at WSSCC, Ms. Trupti Ashtankar, who is the WASH support officer at WSSCC, to set the theme and to share more about the panel today, and then we'll move into the rest of the speakers. Ms. Trupti, over to you.
Thank you so much, Nandini ji. Good morning, everyone. On behalf of WSSCC and GIWA, I welcome you all to this webinar on joining hands for reaching the last mile on hand washing. From 2008 onwards, every year we celebrate 15th October as Global Handwashing Day. And the day serves as a platform to raise global awareness on the importance of hand washing with soap. This year, the Global Handwashing Day theme is hand hygiene for all, and it has a hidden message of leaving no one behind in that. So, as we know, every one of us can protect ourselves, our families, our communities through hand washing with soap. But when the hand washing is done with soap and is practiced regularly at key times, such as using the toilet, after using the toilet, or before contact with food, it can dramatically reduce the risk of diarrhea, pneumonia, and during current pandemic times, we have realized its importance more. Hand washing with soap is key to protecting public health and leads to benefits in nutrition, education, economic growth, and many more things. However, the benefits associated with hand washing with soap can only be accessed when hand washing is practiced consistently at all critical times. And this is the main thing, practicing regularly at critical times. Hence, it is essential that the government, the private sector, civil society organization, and other stakeholders work together towards the cause of promoting hand washing with soap. And for this, today we are honored to have the dignitaries from most prominent organizations leading and contributing to this agenda. As Nandini ji have already introduced our panel, we will be joined shortly by Dr. Saumya Swaminathan from WHO. We have with us Dr. Yasmin Ali, UNICEF country representative, India, Miss Argentina from UNFPA, Mr. Arun Sahdeo, country coordinator, United Nations volunteer, Mr. Vinod Mishra, India coordinator, WSSCC, faith leaders from Hindu, Islam, Sikh, Christian, and Buddhism, and our very own Pujya Swamiji and Pujya Sadhvi ji. So I cannot wait more to hear more from these experts on the Global Handwashing Day. So let's begin our webinar on joining hands for reaching last mile on hand washing. Thank you, Nandini ji.
Thank you so much, Trupti ji, for such a beautiful introduction to the panel. And with that, we will begin from our beautiful, eminent speakers on this panel today. And the first speaker I'd like to call to bless and guide us on this webinar is His Holiness Pujya Swami Chidanand Saraswatiji Maharaj. If he can come and guide us on this message of Global Handwashing Day and why it is more important now than ever before in history. Pujya Swamiji.
Om Asato Ma Sadgamaya Tamaso Ma Jyotirgamaya Mrityorma Amritam Gamaya. Om Shanti Shanti Shanti. My dear divine, distinguished panel, today is Global Hand Washing Day. We all know. It is so wonderful to all be together. I am so proud of our beautiful family members at WSSCC, UNICEF, UNFPA, UN volunteers, and so many other organizations for coming together with our Global Interfaith WASH Alliance on this day. This is a day to come together in the name of health, in the name of hygiene, and in the name of healthy, happy societies. In Indian tradition, in our ancient culture and sciences like yoga and Ayurveda, proper hand washing and hygiene practices have always been a core essential components. Not only washing hands, but having a full bath after using the toilet, before entering to the kitchen, before doing any practice of yoga or puja or meditation. These are the basic fundamental tenets of our culture. I remember from the day one, when I went to the forest, I was taught, before even I went there, at home also. So this was a daily practice and continued till today and will be on. So both yoga and Ayurveda emphasize the importance of purity of both mind and body. But it is very important to remember also that a proper hand washing, for the proper hand washing and for health on any level, we must have clean water. Water is very important. Only when our water is clean, we can properly wash our hands. Only when our water is clean, it brings life and health rather than sickness and death. Water is life, water is blessing, and water belongs to all. So let us pledge ourselves to work together to protect and preserve our water. For the sake
I think we have lost Pujya Swamiji's audio and video. So we might want to just see that. And for a moment, everybody who has joined us on live stream while our tech team is figuring that out, everybody that has joined on live stream on our Global Interfaith WASH Alliance's Facebook page, WSSCC's Facebook, Parmarth Niketan is also sharing with us, as well as UN Volunteers is live streaming. Feel free to share your comments in the comments section, and we will hopefully be able to respond back to you on our social media platforms. And I think Pujya Swamiji has joined us back, so we'll hear the rest of his message. Pujya Swamiji.
So, thousands people watching this, viewing this. I thought for their benefit, I should say something in Hindi also. भारतीय संस्कृति में स्वच्छता का बहुत बड़ा महत्व है. यस, स्वच्छता सिर्फ जैविक आवश्यकता नहीं बल्कि जीवन शैली है. मुझे ऐसा लगता है कि स्वच्छता एक व्यवहार है और जीवन का एक बहुत अहम हिस्सा है. और राष्ट्र के निर्माण हेतु, विश्व के निर्माण हेतु स्वस्थ नागरिकों की बहुत जरूरत होती है. If people are not healthy, how we can have a healthy nation or healthy world? इसलिए so it's very important. स्वच्छता राष्ट्र निर्माण की बात हो या विश्व निर्माण की बात हो, वो आधारशिला है और अनिवार्यता है, बहुत जरूरी है. और सच्ची पूछे मुझसे तो हमें तो बचपन में सिखाया गया कि स्वच्छता की तुलना ईश्वर भक्ति से की गई है कि क्लीननेस इज नेक्स्ट टू गॉडलीनेस. और दूसरा, हमारी स्वच्छता जो है स्वास्थ्य महायज्ञ है और बिना स्वच्छता के उत्तम स्वास्थ्य की कल्पना नहीं की जा सकती. घर, समाज, देश, पूरा संसार स्वच्छता को जीवन शैली का अंग बनाने के साथ साथ सार्वभौमिक यूनिवर्सल वे में साफ सफाई को भी जीवन का अंग बनाए. ये बहुत जरूरी है. पता है आपको 18 लाख बच्चे हर साल निमोनिया से, डायरिया से, भी जी बता रही थी, बहुत सारे और भी बातें मैं रिपीट नहीं करूंगा. अगर हम लोग साबुन के साथ साथ सही प्रक्रिया से हैंड वॉश करने पर अपने बच्चों को याद दिलाएं, ध्यान दिलाएं और खुद भी करें तो डायरिया से, निमोनिया से और कई तरीकों से होने वाली अनेकों मौतों से अपने बच्चों को बचाया जा सकता है. तो ये जो हैंड वॉशिंग की प्रक्रिया है ना, ये एंटीबायोटिक प्रतिरोध को बढ़ाने में बड़ी मदद करती है. इसलिए आजकल खासकर कोरोना के टाइम में वेरी वेरी इंपॉर्टेंट. बचना हो तो बस थोड़ी थोड़ी देर में हाथ धोते रहो. जैसा कि बताया गया है 7 स्टेप्स हैं, उन 7 स्टेप्स को याद कर लें, सीख लें, बहुत जरूरी है. तो स्वच्छता के लिए जागरूकता और सहभागिता बहुत जरूरी है. जैसे आज हम लोग मिलकर, सारी संस्थाएं मिलकर, राइट, लाइक ऑल द ऑर्गेनाइजेशंस टुडे have met together, working together the same way. We have to bring the societies of all religions, for all walks of life together. उन सब को हमको साथ साथ लाना होगा, जोड़ना होगा. और आज यही जरूरत है कि स्वच्छता के लिए हम जनमानस को पूरी तरह जागरूक करें और इस अभियान में हमको निरंतर चलते रहना होगा और इसको चलाते रहना होगा। समाज के प्रबुद्ध, प्रसिद्ध और जितने भी लोग हैं जो युवाओं के रोल मॉडल हैं, ऐसे लोग और जो महापुरुषों को आदर देते हैं, उनको मानते हैं, उनकी आवाज़ को सुनते हैं, उन सबके सहयोग को लेकर स्थानीय भाषा संस्कृति को वाहक बनाकर लोकल लैंग्वेजेस में हमें स्वच्छता संस्कृति को बढ़ावा देना पड़ेगा। अगर हम करेंगे ना, बात बन जाएगी। अंतिम बात पानी की, पानी बहुत ज़रूरी है। पानी है तो पर्व है, पानी है तो त्यौहार है, इसलिए पानी है तो जीवन है, जल है तो जीवन है। इससे जल क्रांति जन क्रांति बने, जन जागरण जल जागरण बने, जल चेतना जन चेतना बने। तो पक्का मानिए, पानी होगा तो हैंड वॉशिंग होगी, पानी होगा तो हेल्थ होगी, पानी होगा तो हम होंगे। आइए मिलकर करें संकल्प, हाथ खड़े कर लें और करें संकल्प कि हम सब मिलकर काम करेंगे और करते रहेंगे, खुद भी जगेंगे और समाज को भी जगाए रखेंगे। धन्यवाद। थैंक यू।
Thank you so much, Pujya Swamiji. We will move straight in. We're running a little bit late and we've had some technical difficulties with Pujya Swamiji's audio and video, but we'll make all of these speeches available on our social media pages immediately after the webinar in the next day or so. And so you can watch them again. And then hopefully we'll have Pujya Maharaji also be joining us in the concluding remarks. By then, hopefully we can figure out any technical issues with his side by then. And with that, we'll request our incredible team led by Dr. Krupali to play the message from the Honorable Health Minister of the nation of the government of India, Dr. Harshvardhanji, has sent a beautiful message on the occasion of hand washing for our webinar today. And we'd love to hear from him on how hand washing is a critical and committed action.
It gives me pleasure to inaugurate this important webinar being organized by the Global Interfaith WASH Alliance in partnership with the Water Supply Sanitation Collaborative Council, as well as World Health Organization, UNICEF, UNFPA, UN volunteers, and many others on the crucial issue of hand washing. October 15, 2020, the Global Hand Washing Day is an international promotion campaign to motivate and mobilize people around the world to improve their hand washing habits. Washing hands with soap and water at critical specified times during the day is essential to maintain health at all ages. This year's theme, Hand Hygiene for All, seeks to raise awareness of making soap and water available globally, especially in public places, schools, and healthcare facilities, where, as of now, a significant population of the world doesn't have access to basic hand washing facility. This can prevent almost 1/3 of diarrheal illnesses and 1/5 of respiratory infections occurring in the community. Further, COVID-19 pandemic has enhanced the critical role that hand hygiene plays in prevention of transmission of the disease. It forms an important component of Jan Andolan for COVID-appropriate behavior launched by the Honorable Prime Minister. In fact, hand hygiene with properly worn face cover or mask and physical distancing has become the most powerful tool and social vaccine to prevent the spread of COVID-19. This will not only create awareness, but also facilitate the behavioral change inculcating hand washing as a regular practice, and will be an important step in the development of healthy lifestyle and disease prevention. I wish success to organizers and the participants.
Apologies. Thank you so much, the Honorable Health Minister of the Government of India, the Ministry of Health and Family Welfare, for such a beautiful message for our webinar today and for taking out the time from your busy schedule to join us. And with that, we will request our respected faith leaders. And from Ajmer Sharif, we have Haji Salman Chishti ji, who's joined us, who will share the message from the Ajmer Sharif, the Dargah, the holy shrine, of how they are celebrating hand washing and the critical role that faith has in spreading the message of hand washing. Salman Chishti ji, if he's on, if we can have him join, that would be wonderful.
Adab, Namaste, Sat Sri Akal, greeting of peace to all the elders here, especially Swami Chidanand Maharaj ji, everybody at the Parmarth Ashram, Sister Nandini and Sadhvi ji, WASH Alliance, who have time and again have not only created awareness, but also influence and initiated participation across the globe of those who not only speak, but those who feel the planet, the family of human, and the nature and the creation within themselves. As Swamiji has so blessed us with his words, that cleanliness is close to godliness. It is equally important to stress upon this aspect of our existence. अजमेर दरगाह शरीफ से जब ये पैगाम आया कि मोहब्बत के साथ साथ हमें वो खिदमत भी अंजाम देनी है, ख्वाजा साहब का जो पैगाम था कि मोहब्बत सबसे और नफ़रत किसी से नहीं, तो मोहब्बत का एक बड़ा आयाम जो spiritual maqam, you know, the spiritual station of love, unconditional love, is presenting yourself to the divine in the purest of manner. कि साफ सफाई निफ्स ईमान, that cleanliness is half of faith. That is a hadith and the sacred saying of Prophet Muhammad, peace be upon him, sallallahu alaihi wasallam, कि साफ सफाई को आधा ईमान बताया गया, आधा आपका faith बताया गया है. In Islamic spirituality, in tasawwuf, and in the Sufi orders, the first and foremost aspect of the spiritual path is cleansing of your nafs, cleansing of your ego, cleansing of your physical aspect. इसीलिए जब हम इबादत के लिए जाते हैं, नमाज के लिए जाते हैं दिन में 5 मरतबा, तो इबादत में अपने आप को पेश करने से पहले उस रब के सामने ये लाजिम है, it is mandatory, not an option, but mandatory to clean yourself ritualistically, wash your hands in a proper way so that you can present yourself to the divine to pray and to worship. So the message today, it is important as the Global Hand Wash Day, and with the initiative WASH Alliance, I think in Dargah Ajmer Sharif from last 1 week, since Nandini ji and WASH Alliance has asked us to prepare a video, I think that is one of the most exciting part about it, especially with the children. We have shared a video which later it will be played, and the children were so excited. Matlab, दिन भर they prepared themselves not only around Dargah Ajmer Sharif, but we also started this campaign around the villages of Ajmer Dargah Sharif. We went to the villages and created the awareness that 15th October is the Global Hand Wash Day, और आप इसको किस तरीके से अवेयर कर सकते हैं अपने बच्चों को. तो वहाँ पे बच्चों ने अपने हाथों को धोया साबुन से, and they literally were so excited to share their experience of feeling the cleanliness experience. So I think it is equally important to come again and again on such platforms, and we really wish and pray that WASH Alliance and all the global organizations who have contributed to create this platform will definitely be a landmark collective aspirations to have cleanliness. इसी तरह हम ये दुआ करते हैं कि जिस तरह हदीस बताई गई, खाना खाने से पहले आप हाथ धोएं, खाना खाने के बाद हाथ धोएं. पर्सनल हाइजीन, जब तक हम स्वस्थ नहीं रहेंगे तो हम कोई खिदमत भी नहीं कर सकते. If we are not healthy, we can't even serve. To serve our nation, we have to be healthy. So I'm reasserting Swamiji's message, that is aspect of our own serving the nation in the best of manner. So let's make collective prayers, duas, and resolve that before we opt for praying, we have to be clean, ritually clean ourselves, and hand washing with soap is an essential aspect of making yourself clean. In the 10th century, I was reading about the cleanliness aspect in the global environment. In the 10th century, the streets of Baghdad were washed twice a day with soap. So in the ancient time, the level of hygiene was such that the streets were washed twice a day with soap. Are we washing our hands twice a day with soap? That's the question today to reflect upon. If we are clean, our neighborhood will be clean, our mohallas will be clean, our city, our state, and our nation will be clean. And that is really Swasth Bharat, Swachh Bharat. And we salute the resolute call to this from day one. The Prime Minister of a country has taken up the highest chair in the country to serve. And I think that has made a great difference into the rural areas as well as urban areas. With this prayers, lots of blessings and duas from Ajmer Sharif. We seek blessing and duas of all the spiritual elders who are part of this, all faith leaders. Keep us in your prayers so that we keep serving. Thank you. Salam, adab, and satrikal. Namaste.
Thank you so much. Thank you so much, Chishti ji, for joining us from Ajmer Dargah. And we're truly very blessed to have the Himalayas, the banks of Ganga, the beautiful shrine of Ajmer Sharif here, giving us these blessings and these messages of cleanliness is close to godliness. And we'll request, as I mentioned, that we don't have a lot of time. We're running slightly behind schedule a little bit, and we're making up for that time in shortening the introductions of our esteemed panelists. But I request, and I request an apology beforehand from everyone for doing such a gustaki maafo. Lekin I request ki our Father Paul, who is the Executive Director of Caritas India, who is here with us to share his message to continue the flow of this webinar. Father Paul. Is Father Paul with us?
Nandini ji, am I audible?
Yes, you are.
Thank you so much, Nandini ji. आप सबको मेरा प्रणाम. पूज्य स्वामी चिदानंद सरस्वती जी, Pujya Swami ji, Sadhvi ji, and global and the galaxy of eminent panelists. I appreciate and congratulate Global WASH Alliance for observing the International Hand Washing Day with this beautiful theme. Just recently, you know that Caritas India was awarded with the Healthgiri Awards for being the best NGO in the country during the Corona pandemic times for the contribution to the health sector. And one of the indicators of this award was the initiative we took on this particular account of initiating the hand wash systems, introducing hand washing stations in different parts of the country. We did that precisely taking this particular theme that community is the solution. And the theme of the day is something very, very contextual, that how do we get it done at the last mile? And we strongly believe that community is the solution. And we know that hand washing has become the new normal. Maybe in the Corona pandemic times. We know that it is really bringing a new behavioral change in the communities. Maybe Corona pandemic time has really helped us to remind us once again that this should be the kind of a preventive approach to our health solutions, And we know that this is not something new. Our Pujya Swamiji already referred this to from our Vedic traditions. In fact, our country has rich traditions of holistic health. And we know the trajectory of the history, how the health scenario and the healthcare system evolved. But sometime down the lines, we forgot these beautiful traditional values and methods that were given to us. And eventually we forgot the value of hand washing also. Maybe if I just make a quick mention from the book of Bibles. In the book of Leviticus 15:30, it is said that when you have an issue of sickness, illness, then you shall clean yourself fully for 7 days with running waters, and you shall be clean. It's a beautiful reminder from all the religious traditions that washing the full body, including the hands, has something to do with the human dignity and respect to the body. When you respect your body, you are respecting others as well. So, my dear brothers and sisters, what is important today is to bring that kind of a cultural and behavioral change, so that this change is being popularized, accepted and assimilated and internalized by every individual. But when we say that, we should give enough thought to the solutions as well. What is important is to have the localized solutions. In the context of the country, when we have millions of our brothers and sisters who are deprived of the basic facilities, when we say that even that water, which is something very key determinant, when we promote the idea of hand washing, let us understand that there is a reality of a water poverty. And we have these staggering issues of clean water in our homesteads, especially in the rural villages where there is such a lot of water stress that's being experienced. So to promote hand washing, we need to also think equally in terms of protecting, safeguarding, providing water solutions as well. So this should be also a message that we should be taking so well into our considerations. And I would conclude saying that maybe this is a kind of a practice that we should promote from the early ages of our children community as well. And there's some beautiful experiences. So I would request that we popularize social robots to communicate with our children so that they get into this and this becomes a joyful experience of Hashwa. And so I conclude. Thank you so much for this opportunity, always with Global WASH Alliance and Parmarth Ashram. Thank you so much, Swamiji, for this opportunity given to me to be part of this beautiful conference. God bless each and every one of us.
Thank you so much, Father Paul. Thank you so much for joining us. I know you have another webinar. So again, very, very heartfelt thank you from GIWA, from WSSCC, from Parmarth, from all of the beautiful organizations that have come together for you to join the panel. And beautiful messages from our faith leaders just now that have really brought together the core essence of the faith leaders coming together for promoting hand washing, reflecting on the traditions that have already emphasized cleanliness as a core and critical fundamental element of faith. And we'll have faith leaders' messages more of how they celebrated hand washing in their institutions, in their schools, towards the end of the webinar. So stay tuned, stay with us throughout the webinar to see those beautiful messages, because they're truly very special. And we will move next to our beautiful Shakti-filled panelists and eminent speaker who is joining us from the UNFPA India. She is the representative of UNFPA India and the country director for Bhutan. And she has a career spanning of over 40 years. And Miss Argentina Piccin has been the forefront of programs that have focused on the rights and the health of women and girls. She has given voice to the youth and the adolescents, and she's extremely passionate and committed to ensuring rights and choices for all. And we're incredibly, incredibly excited and blessed to be working with her in so many areas and empowering adolescents and youth in Uttarakhand and in India. Without further ado, I'll request Miss Argentina to share her thoughts on this occasion of Global Handwashing Day. Miss Argentina.
Thank you so very much, Nandini ji, for this beautiful introduction. Your Holiness, the Most Venerable Pujya Swamiji, thank you so much for the blessings. We really felt them across the screens. I wish we could come to the ashram, but with this COVID, we have to wait. The Mevlana Haj Said Salman, thank you for your beautiful message and blessings as well. And the Reverend Father Paul Munji, divine and beloved Sadhvi, thank you for including me in this program. And all the venerable saints, spiritual leaders, colleagues from civil society organizations, of course, my own very dear colleagues, Drs. Yasmin and Dr. Saumya from UNICEF and WHO, who will certainly have a more scientific way of helping us, enlightening us on this very topic. But of course, I'm very privileged to be part of such a platform with eminent saints and speakers and scientists. I'm sure, of course, that when Pujya Swamiji co-founded GIWA, trying to convince people to wash their hands and keep their environment clean, it was probably not the most easy thing in those days. But like many initiatives that seek to change people's behaviors, it is always very challenging to convince people to change the way they do things, or to tell them that the simple action of washing hands would ward off half of the diseases in their lives. Ironically, it has taken a giant enemy such as COVID-19 pandemic to force the world, the nation, and individuals at family level to reposition hand washing right at the center of the strategies for us to stay alive as a community, as individuals. And I know that, of course, from UNICEF, who has for decades been working on this very issue of promoting hand washing, especially to save babies and children, we will hear a bit more. And we have our own scientists from WHO, the World Health Organization. But nonetheless, because UNFPA works with women's and children's and girls' health, I will say a few words on the linkages between hygiene and women's health. Already, I can refer to the mid-1800s, when a famous British doctor, rather, made himself famous because he established a direct linkage between the habit of hand washing of doctors in the maternity wards when they left one patient and moved to another, and the rate of infections and the deaths of those women after, immediately before or during and after birth. So he saw that if he instituted just that simple method of hand washing, when you're finishing the one patient going to another, that the maternal postpartum infections dropped, and consequently the deaths of babies and women also reduced. And so, but where are we now in India today? The total contribution of infections, postpartum infections after childbirth, that's what I want to say, is about 10%, a full 10% of all maternal death could be averted at the hospital level after childbirth if doctors and midwives could wash their hands. What about girls? I said I'll speak about girls as well. This is a population group that often gets particularly and negatively impacted by poor hygiene and lack of clean water, especially starting at their puberty age. Why is that and what happens? We have millions of girls around the world missing school every month between 3 and 5 days during their menstrual period, because they are not able to participate in outdoor activities, which includes school or playing with their friends with dignity, because they have no water or sanitation facilities and supplies like sanitation pads to help them, feel confident to come out. According to the Indian Family Health Survey, about 1/3 of all households do not have access to clean water on their premises. And for that reason, we have as many as 23% of girls dropping out of school upon reaching puberty. In families where water is not available, we also see the burden of women and girls increase. Girls often arrive at school very late because they are busy trying to supply water for the families. Their education is compromised, employment opportunities and productivity affect. And the list, of course, goes on. A very natural occurrence, just as menstruation for girls, which should be celebrated as an integral part of their womanhood, ends up instead being a curse, because it is an obstructor to her ability to fulfill her God-given talents and to participate and to belong to her community. So you may ask, what is UNFPA doing to promote hand washing and sanitation habits? In all our programs, UNFPA raises awareness and encourages the practice of hand washing, most especially among health providers in maternity wards, but also at the community level. We concretely, in the states where we have offices, we have district-based technical health personnel, regularly visit health facilities and work with health workers, encouraging them, involving them in adopting technical skills as simple as hygiene practices and washing hands. We also support in large scale the government scheme for young people called known as RKSK through our life skills education program, which a few other UN agencies have, like UNICEF and UNESCO, in and out of school. And that includes a very strong component on hygiene. During the COVID response right now, we have joined hands with the Ministry of Health, with our state offices in campaigns to promote COVID appropriate behaviors, which of course hand washing is at the center. And during disaster, to name just a few, we provide dignity kits to women and girls, which include soap, sanitary pads, and other hygiene items. And these help them to really participate and cope with emergencies in a very dignified manner. In conclusion, I would just remind us of very practical aspects to improve sanitation and hand washing. As the Mevlana Said was saying, what is it that we're doing concretely? What can be done? I think that if governments would prioritize resource allocation for clean water and sanitation facilities in all schools and health facilities, already that would go a long way. If we could include appropriate hand washing practices and performance as a performance indicator for all healthcare personnel, we could ensure that counseling on correct hand washing technique continues to be part of frontline community health workers such as Anwagardis and Ashas, not only during COVID, but even beyond. We will need that to continue. And lastly, but just naming a few, as I said, involving women in all decision-making at the household level, at community level, when it comes to matters of water resources. most venerable, holiness, and distinguished participants, women bear the brunt of reproductive role in the family by their own natural God-given role. But it's not only, when we speak reproduction, it's not just in childbearing, but it's also to pass on and enforce values and culture and traditions from generation to generation. So if we only focused on women and girls primarily, we are sure to succeed in the campaign for hand washing behavior and improve sanitation. It is high time we saw women and girls as agents for positive change. Thank you very, very much. Dhanyabad.
Thank you so much, Ms. Argentina Piccin from the UNFPA India, for such a rich discussion and adding such value to this webinar, and really discussing how hand washing is so important and so critical in prenatal care, in maternal health, in empowering women, and also in ensuring that children and adolescents and youth hitting puberty are healthy and clean as they do so, and are able to not just survive, but thrive. Thank you so much for your beautiful message. And like I mentioned, we'll have these rich and beautiful discussions available on our social media platforms. We have with us we've just been joined by Dr. Saumya Swaminathan, who is the chief scientist from World Health Organization. She has just joined us, and she's only here for 10-15 minutes, but has taken out some time from her very busy schedule today on Global Hand Washing Day to be with us. So I would request my respected Shri Vinod Mishraji, who is the WSSCC India head, to introduce and welcome her to this panel on our Hand Washing Day. Vinod Mishraji.
Thank you very much, Nandini ji. So we all know Dr. Saumya Swaminathan is an eminent scientist. She is from India, and she is contributing towards the globally in the field of hygiene and sanitation and the health. So good afternoon, Dr. Saumya Swaminathan, madam. It is really our pleasure and honor to welcome all to you on behalf of the Global Interfaith WASH Alliance, Water Supply Sanitation Collaborative Council, UNICEF, UNFPA, UN volunteers, and more than 500 participants participating online across the country.
I messaged her beforehand asking if it was
okay
to
we all
Saumya
aware about
and she said,
your work, what you are doing in the field of health and hygiene. Everybody knows it. During the COVID time, your messages certainly will go to the masses, to the last mile in the country, so that people can get awareness about the hand washing, because this is the one of the major tools to combat the COVID. Masking and physical distancing and hand washing. These are the major three tools. So with these words, I'd like to invite Dr. Saumya Swaminathan to address this webinar so that your message can go to the masses in the country. Ma'am, please.
Thank you, Vinod ji, and greetings to everyone today on this Global Hand Washing Day. First of all, let me say that it's a great pleasure to speak to you all, particularly since this is an interfaith gathering, and it's a very unique concept, I think. And what is really important is that to understand why hand washing is important. Of course, everyone here understands that, but to convey it in a way, to do the advocacy in a way that people actually adopt that as a behavior change, because ultimately it's a question of the behavior change which every individual has to adopt. And I think who are the people who can bring about that change in societies, in communities. I think that is where the faith leaders of every possible faith and religion can play an important role. And I'm thinking back to the time of the polio eradication campaign in India, when many religious and spiritual leaders and other community leaders, including, celebrities, role models, people whose voice really counts in their communities, they played such an important role in ensuring that children got polio drops. And ultimately, India, against all odds, nobody expected that India would be one of the countries to actually eliminate polio at that time, but we were able to do it because it was a mass movement, because every individual in India, I think at that time, had heard about why polio drops are important. I think everyone from small children to older people knew about the polio campaign, knew what polio was and why the immunization was important. Still, we had pockets of resistance. There were misconceptions, there were fears, there were rumors, either purposely done or unknowingly done. And that is what stopped, the immunization from reaching 100% till some of the faith leaders came into the picture and took it upon themselves in their sermons, in their preaching, to tell people that it was a good thing and it was not against faith or religion to accept polio drops for their children. So I think it's similar with hand washing, and of course it's coming to the spotlight this year because of COVID. We learned very early on that this virus transmits by droplet transmission. So it is mainly person to person, people who are in close contact with others and who come into contact with the droplets of somebody who's infected, who's speaking or shouting or talking, laughing, singing, etc. And if you're within the 2 feet distance, you could have droplets actually directly falling on your face. Of course, these are so small, you don't see them, and then being inhaled to cause the infection. The other mode we know is through objects, what we call as fomites in medical language. But basically, if somebody who's infected has been touching their nose, mouth, etc., and is carrying the virus on their hands, or if somebody sneezes or coughs and those droplets fall on a doorknob, or they fall on a table, or they fall on an object which somebody else is soon after that is going to touch, carry the germs on the hand and then touch their own face. This is the second mode of transmission. And we have been understanding more about this virus as time goes on. It's only 9 months we have been living with this virus. We also know now that there is some amount of airborne transmission. So droplets, which are small in size, can actually stay in the air for some period of time, and maybe for an hour or two. And if this happens in a closed setting where there is no natural ventilation, where there's a closed space where a lot of people have accumulated and they are breathing the same air, then what happens is that you could have also this type of transmission occurring, even if you're at a further distance from the infected person, more than 6 feet away, but you could still be breathing in the air with some of the smaller particles with the virus. And this has been documented in few settings, but what we say is happens usually in closed, poorly ventilated settings. So 3 C's we talk about. We talk about crowded places. These are the 3 C's which need to be avoided. So crowded places, close contact with people, and closed indoor poorly ventilated spaces. I think it's easy to people to understand the 3 C's and to avoid. But the 4th one, which is really important, is the hand hygiene, which is something that WHO started popularizing and advocating for right from the beginning. And also showing people what is the correct way of washing hands, how many seconds you have to wash your hands for, and how to dry it after that. And there have been big campaigns, global campaigns. Again, a lot of celebrities and others joined into the hand washing challenge that we had. In May, we had a day that was focused on on hand hygiene for nurses and midwives, because this year, 2020, is also the year of the nurse and midwife. And of course, these are the people in the front lines of healthcare. And they are the people who, most of them are women, most of them are serving the rest of community. And they were the ones actually exposed also to the virus because they were at the front line. So doctors, nurses, midwives, and other types of healthcare workers. It's really important that they are safe, that they are protected, because if the healthcare workers are affected and get diseased and die, unfortunately, we have seen a disproportionate impact of this virus amongst healthcare workers. In most countries, healthcare workers constitute not more than 3% of the population. But overall, the statistics that we have on COVID-19, 14% of the cases have been among healthcare workers. And I think this was particularly in the early days of the pandemic, when they were really disproportionately impacted, when there was a shortage of personal protective equipments around the world. And unfortunately, we lost also many, many doctors and nurses. And they are the real heroes actually of this pandemic. They died while they were trying to save other people's lives. But they should not die. And they should have the protection and the equipments that they need to protect themselves. And of course, if you're in a healthcare setting, hand washing is extremely important. But then you also need masks, you need gloves, you need goggles, and you need gowns if you're dealing with infectious diseases. Now, a survey done some time ago actually showed that 40% of healthcare facilities do not have running water and soap. So if you do not have running water, it is very difficult really to advocate for hand washing, frequent hand washing. And this is true also. So if you can imagine that 40% of healthcare facilities across the world don't have this, then you can imagine communities also. We know that urban slums, for example, in many countries face shortages of water. I have been in a slum in Nairobi, in Kenya, where there was a local, in fact, it was a local business, an enterprise to actually sell drinking water. Like we buy milk from a kiosk, you can go and insert your card or your token and purchase water in liters. For most of us, we take clean drinking water for granted. And for those of us who are able to afford it, we have filtration systems, we have purchasing, good quality water. But for a large proportion of the world's population, still people do not have access to either clean drinking water or sanitation. And certainly running water is a big concern in many communities. So I think this is where we can try to shine the spotlight. What should we be doing? What should we be focusing on? Just raising awareness of hand washing is not adequate. We have to also look at the challenges that people face. I think we're facing the same with coronavirus. We're telling people to do this, you do that. But to really bring about behavior change, you have to understand people's beliefs there and also their challenges in their day-to-day life, the constraints, the bottlenecks that they have, why they are not able to follow the suggestions or the recommendations. So we need to be speaking to communities. We need to go into communities and work with them and with the community-based organizations, NGOs, and with religious leaders and groups so that we can make a change. And change has happened. A lot of change has happened. A lot of positive things happened because people recognize that this is important for us. If they recognize that menstrual hygiene is important, the women in the community will ensure that change happens. Similarly, I think it is women we've seen across the world who have fought for the rights of some of the basic things. And we still have far too many women across the world walking miles and miles to collect water and to collect firewood, just so that they can prepare for their families' food and have enough water for drinking and washing. So that is where we need to focus. We need to ensure that women are not undergoing this type of drudgery. It's all unpaid work, it's all uncounted work. And we know from the impact of the COVID pandemic, the impact on girls and women is going to be disproportionately worse than on men. more women are going to be living in poverty, more women have lost livelihoods, and more women are facing domestic abuse, gender-based violence, and more young girls may be dropping out of school and may end up with early marriage and so on. So there are many things which are going to impact our social fabric in the months and years to come that we need to be very vigilant against. And as leaders, we need to be speaking up, we need to be advocating to protect the most vulnerable in our societies. And I think one of the things which is true is that running water is necessary, for basic survival. It's one of our basic needs, and we need to ensure that this happens. And so it's very good to see that we had the Swachh Bharat program, and now we have the Jal Jeevan Abhiyan, which actually aims to bring drinking water to every household in every village. And this is exactly what we should be supporting. So if side by side, we can do the advocacy and behavior change. And hand washing and mask wearing, I think, are going to have implications and impacts beyond COVID. If it becomes a habit, we will be able to reduce the incidence of other food and waterborne diseases like typhoid, like cholera, like gastroenteritis in children, which still unfortunately makes so many children sick and die every year. So hand washing is going to have impacts beyond the COVID-19, and so is the wearing of masks. We saw that the flu season, influenza in the Southern Hemisphere this year was very, very much lower, almost 98 or 99% lower than normal flu season. And that's because everyone was wearing a mask, taking precautions, cough hygiene, respiratory hygiene, and hand hygiene. And because of that, we've been able to reduce another respiratory disease, which is influenza. So again, for the community, I think the message is that it's not only about COVID and then you go back to normal after that. It's something that's going to make you healthier, reduce infections, reduce diarrhea, and contribute to better health. And so I think it's a very good opportunity to raise awareness on that in the context of the pandemic, but then talk about its benefits well beyond that. So thank you very much for giving me this opportunity, and I will turn it back to you, Vinodji.
Thank you. Thank you very much, ma'am. So Nandini, over to you.
Yeah, thank you so much, Dr. Saumya ji. We just have a short thank you from GIWA's side. I request Pujya Sadhvi Bhagawati Saraswatiji, who is the Secretary General of the Global Interfaith WASH Alliance, to thank you for joining us for the webinar in a very, very busy schedule as you have today. Pujya Sadhvi ji.
It has been such a joy and an honor to have you with us. And I wanted to thank you not only for being with us today in this webinar, but for being such a great voice, a great power, a great Shakti for health and for the empowerment and upliftment of our women and girls. And you've given us today such a simple and powerful capsule of 3 C's for a society that then is healthy and happy and harmonious. So our 3 C's for a 3H society. And we are so touched to have you with us. And on behalf of our Global Interfaith WASH Alliance, our signature gift when this pandemic is over and we're able to welcome you here to Parmarth Niketan, our signature gift is a tree sapling. Because as you mentioned so beautifully, and as Swami had spoken to here today, without clean water, you can have all the soap in the world, but it's not going to get you clean. And we know that trees are an essential component of water, and especially here in the Himalayas, so many of our streams and rivers originate not only in glaciers, but actually in the trees of the mountains. And so on behalf of GIWA, we offer you beautiful sapling of the tree, that may it bring water clean water, abundant water to our earth. And we hope so much to have longer, deeper, and even more powerful interactions moving forward. And again, thank you so much for joining us today. And given I know that we have a shortage of time, I wanted also just to quickly mention our next respected speaker, Dr. Yasmin Ali Haque, the head of UNICEF in India, who is another fantastic power and Shakti for children, for women. We had Argentina, Matavel, the head of UNFPA in India, speak a little earlier. And now we have our Dr. Yasmin Ali Haque, who is just leading UNICEF with such vision and such commitment for children, for their health, for education, for girls and women. And it's such a great joy and a great honor for us to continue to work hand in hand and heart with UNICEF. So with the tree in gratitude to Dr. Saumya Swaminathan, we'll hand it over to Dr. Yasmin Ali Haque.
Thank you very much, Sadhvi. Nice to see you, Saumya, across the countries. Swamiji, our spiritual leaders and colleagues at WSSCC, my colleagues in the UN, Arun and Argentina, and really our participants in this important celebration of the Global Handwashing Day. Who would have thought that something our mothers were constantly reminding us of would become such a global event? And we've heard so well from Saumya ji about the scientific basis around it. And Argentina has so well talked about the role it plays in really preventing death, disability, and disease of women and young girls. It's such a simple measure, yet it is so effective in preventing infection and the spread of many diseases, and now especially COVID-19. Wash your hands thoroughly with soap and water. So we're not even talking about anything, very high tech. It's something that's there, available, and is so important. It's simple, yet it still doesn't translate into a behavior which is well practiced. Because when even in the COVID pandemic, when we have gone back and seen our people practicing the information that is being given out, we see that it's not happening to that extent. We estimate that about 3 billion people, 40% of the population, don't have a place at home to wash their hands with soap and water. In India, only 49% of rural households have water and soap facilities in their house. Recent studies found that only 61% of people practiced hand washing when returning home from being out of the home. And only 34% do so after sneezing or coughing. So one of the biggest reasons for not practicing hand washing is, like we heard from Dr. Saumya, the lack of a place to wash hands, not having soap, and limited access to water. So when families do not practice hand hygiene, when we as individuals do not practice hand hygiene, it's really the children who suffer the most. And we know that 700 children die every day from diseases caused by inadequate water, sanitation, and hygiene. And diarrhea is still one of the leading killers of children worldwide. Hand hygiene, of course, is a key condition for schools to reopen and build confidence of the community to send children to school. So when we're talking about safe reopening of schools, UNESCO, WFP, UNICEF, and the World Bank have come together to issue guidelines which are important in the safe reopening. having access to the facilities, together with really teaching children, encouraging them, talking to them about the importance of hand washing, is all part of creating a safe environment. As we heard, the Jal Jeevan Mission campaign, which was launched on 2nd October to reach potable piped water to all schools and Anganwadi centers. This 100-day Jal Jeevan Mission is a huge game changer, and it needs to be implemented well. And we have our instructions from the highest authority in the country, from the Prime Minister himself, to ensure that this is done, because it is so, so important for children and for their families. We're also working very closely with the Ministry of Education in training teachers, in training their staff, and in translating that into encouraging children in really looking at COVID appropriate behavior. UNICEF and other agencies, we've been working with a range of partners since the beginning of the pandemic to work on prevention and control through appropriate behavior. And we estimate that we've reached about 650 million people with COVID-19 prevention messages. And the role of religious leaders and media has been leveraged for this. We would not be able to do it as one organization by ourselves or one community by ourselves. We've also worked with young people as volunteers in their communities, and I mentioned working with teachers too. Sorry. Also, I'd like to flag that UNICEF and WHO have launched a Hand Washing for All campaign, a global call to action for all countries to create their own national hygiene roadmaps. We have to be very clear on what systems need to be put in place to make this a reality for everyone, especially those who do not have access. We continue to work closely with the Ministry of Jal Shakti to develop a national roadmap. And we're also working closely with the Ministry of Panchayati Raj to assist the panchayats, the gram panchayats, in strengthening the water sanitation and hygiene promotion in their areas. I just wanted to also take this opportunity to specially thank all our spiritual leaders who are here today, because faith-based organizations are important partners to work with children and their families. Our executive director, Tony Lake, our previous executive director, had noted that long before there was a UNICEF, faith communities were among the greatest advocates for the world's neediest children. In fact, the Convention on the Rights of the Child, which is the most widely accepted human rights treaty in the world, reflects deeply held values embedded within religions and within traditions that are inherent dignity of every child. Faith plays a big part in constructing cultural, sociological, and personal behavior in India. Almost 99% of India's population identifies with one religion or another. Faith-based organizations provide UNICEF with the reach, which helps us access areas and communities that we normally would not be able to reach. And by getting India's top faith leaders and organizations into the sphere of public advocacy, like we're seeing in the efforts that GIWA is taking forward so strongly, we hope to spark a powerful, widespread social movement for water, sanitation, and hygiene. Hand washing is not just a matter of individual choice. It's a societal imperative. It has to become aspirational too. We can support with the technical know-how. We can look at working with different entities on cost-effective solutions, eco-friendly solutions, so that we're not wasting the valuable resource of water. And our role to work with the faith leaders in getting the messages far and wide and building the confidence and trust of communities is something that we aspire towards. Thank you very much, and let's all continue to wash our hands with soap regularly. Thank you.
Thank you so much, Dr. Yasmin, for gracing the panel today and for sharing all of the incredible work that UNICEF is doing on hand washing, and also that UNICEF India has been so pivotal in really illustrating under your leadership, under your Shakti, how these organizations can come together and how faith leaders can come together to really reach the last mile, to reach the most vulnerable populations, to reach the most marginalized populations. So thank you so much for such a powerful, beautiful, rich sharing of all that UNICEF India is doing. And we're so, so glad to have had UNICEF India, WHO, UNFPA India, and all of the faith traditions here today, and UN volunteers here with us. Thank you very, very much. Again, a very heartfelt thank you from GIWA and from the WSSCC for joining us today and for being in partnership with us for ensuring that hand washing really reaches everyone. And with that, I request Dr. Sadhvi Bhagawati Saraswatiji, who is the Secretary General of the Global Interfaith WASH Alliance, and we just heard from her just a few minutes ago, and we welcome her back to share her address on hand washing and ensuring that hand washing really reaches to the most vulnerable populations, the most marginalized, and addressing the gaps in hand washing. Dr. Sadhvi Bhagawati Saraswatiji.
Param Pujya Swamiji, all of our respected, revered faith leaders, Dr. Saumya Swaminathan, Dr. Yasmin Ali Haque, our Argentina Matavel Piccin, Sri Vinod Mishraji, all of the leaders who have come together, both those who are speaking together with us in this beautiful coming together on Zoom, as well as all of those who are joining us on all of our social media platforms. It's such a really great joy and great honor to come together for this today and to see the way that we're bringing together not only leaders of different religions, but actually leaders of so many different sectors, making us remember that health, hygiene, and solutions to them, including hand washing, are everyone's responsibility and are areas in which everyone, whatever sector you may be in, from government and policy to the United Nations, to NGOs, to faith leaders, everyone has the power to really make a difference. We know that hand washing is one of the simplest, least expensive, easiest, quickest tools that we have to actually transform the health and the hygiene of our world. As we sit today waiting for a vaccine for COVID, as we sit here waiting for so many medical miracles, we have with us already a medical miracle, a health miracle, this incredible thing with just some water and some suds, how we actually can prevent so many illnesses, so many needless deaths. We've heard so many statistics today, and a couple for me that really stand out, given to us by the United Nations, given to us by the Center for Disease Control, is that nearly 2 million young children die every year due to diarrheal and respiratory illnesses. Nearly 2 million kids just due to issues of diarrhea, issues of respiratory illnesses. And yet, simply good hand washing with soap actually can prevent about 1/3 of those diarrheal illnesses and about 1/5, about 20% of the respiratory illnesses. Now you think how many children's lives can be saved across the world by something that we already have in our hands, hand washing. And so it's beautiful to come together today and to be able to celebrate this wonderful miracle of technology. And also though, to highlight how having access to the water, the soap, the education and awareness of proper hand washing really needs to count as a human right. When we have the right to life, surely we should have the right to know how to protect and preserve that life. And surely we should have the right to the most basic, fundamental elements that enable us to protect and preserve our life. And so as we excel in science and technology, as we are sending people to Mars and in outer space and finding sort of alternate planets that maybe we can live on if we manage to ruin this one, can't we take some of that time and energy and use it to actually harness the power of technology we already have, science we already have, something that doesn't need to be invented, simply needs to be harnessed, channeled, and properly implemented. It's not rocket science. And so while outer space is certainly very exciting, we really should commit ourselves equally to ensuring that this space here on Mother Earth with our family is one that is healthy, that is sustainable, and which everyone has that access to protect their health. Lastly, time is very short, but lastly, when we work in a lot of development spheres, tragically, sometimes those spheres can actually become silos. And it can look like and feel like we are working for education over here in a vacuum, or women's health or rights over here in a vacuum, and the environment over here in a vacuum, water over here in a vacuum. And yet the 17 Sustainable Development Goals are not 17 silos. They're not 17 vacuums. They are interweaving and interwoven threads of one tapestry of health, happiness, harmony, sustainably here on planet Earth. And I mention that because as we speak about hand washing, it's very easy to forget that so many of the soap products that are widely available actually are made of chemicals that are not so healthy for our fields, for our water, and that in the name of hand health and in the name of hand hygiene, we are actually bringing detriment to the environment, to our soil, to our land, to our groundwater, to our rivers. And then over here, we run over here then to try to protect and preserve our water. And so rather than think about it and work for it and advocate for it in these vacuums, if today itself, as we are advocating hand washing, we advocate all natural soaps, not the chemical kind, not the synthetic kind, not the kind that cause toxicity in our water, but actually the kind that are made with natural ingredients. And for an added bonus, the kind that are made most frequently by rural women in villages, in livelihood programs and self-help groups. So we have this beautiful opportunity to weave together the threads of hygiene, of health, of environmental protection, of water, of women's empowerment, of livelihoods, of development, green development, all together into one tapestry. So let us today also really remember, celebrate, and commit ourselves to creating a space and a market for these products that the women in the villages are making, for these natural soaps, the same way that when we talk about menstrual hygiene, we focus on eco-friendly solutions. We focus on reusable menstrual pads. We focus on biodegradable pads. In the same way, let us focus today on soap that isn't wrapped in single-use plastic, that isn't that which when it goes down the drain, it pollutes our water, but that which is natural, that which is organic, that which is uplifting the women and the girls in our villages together, so that Global Hand Washing Day becomes in and of itself a tapestry for health, hygiene, environmental protection, water protection, upliftment and empowerment for women and girls, leading, of course, to our peaceful societies. Thank you so much for this beautiful opportunity, and thank you so much once again to all of our partners and our Global Interfaith WASH Alliance team for bringing this beautiful webinar together.
We are experiencing some difficulties with Sadhviji's audio and video towards the end, but I think we got most of the message very beautifully and very clearly. And the emphasis on not only us coming together in concerted actions for hand washing, but the beautiful tapestry that she speaks about, and really using hand washing as a medium and a means to connect all of the sustainable development goals. Thank you so much, Pujya Sadhviji, for such a beautiful, comprehensive, and really enlightening talk about how this also is not just about hand washing, but about all of the sustainable development goals and what role we all have to play in this. And the soaps that she was speaking about, and really the message of eco-friendly soaps, we have a beautiful video towards the end of the webinar, in addition to the faith leader videos of women who are actually working to make eco-friendly soaps so that at least the chemicals from the soaps aren't polluting our waterways and then in turn polluting our soil and our environment. So thank you so much, Pujya Sadhviji. And we ask to move into the next panelist, our speaker who has joined us from the United Nations Volunteers in India. He is the country coordinator, Shri Arun Sahdeo, who is going to share with us all that the UN Volunteers is doing for promoting Global Hand Washing Day, and the volunteers that have been working up to Hand Washing Day and beyond to really take these messages of sustainable development goals to the grassroots, to the most vulnerable populations, and ensuring, like the theme of this panel, that
Your Holiness, Pujya Swami Chidanand, Swami Saraswatiji, Haji Syed Salman Chistiji, Father Paul, other spiritual leaders, even colleagues Yasmin, Saumya, and Argentina, and of course friend Vinodji. I am really honored to be part of this webinar today. So first of all, I would like to compliment and congratulate the organizers, WSSCC and Global Interfaith WASH Alliance for this wonderful program. Very briefly, I will touch upon two things, how UN volunteers have been contributing towards overarching theme of sustainable development, particularly in the context of India, and also this particular campaign which is being conducted currently with the community of volunteers across the country. So first of all, as we know, this is something where volunteers have been doing a lot of things. And I would like to focus on today's discussion and some of the words which have been, and some of the vision and kind of, blessings from the faith leaders in terms of management of water, integrated approach, plastic management, nutrition, hygiene, health, and then basically focusing around bringing social behavior change. And I think volunteers are the greatest resource, greatest assets available anywhere in the world. And if we talk about bringing behavior change among the people, I think there is no other asset as valuable as volunteers. Globally, we have 1 billion people, 100 crore people who volunteer every year. And if you see the contribution, it is almost equivalent to full-time 109 million workers. So almost 11 crore full-time workers. No government, no private sector, no organization can have that many number of people who work without any expectation from the society. So what I want to say that volunteers are the great resource, not only in India, but across the globe. But then volunteering happens mainly in non-formal, informal volunteering. Only about 30% volunteering takes place in formal structures through organizations, associations, and groups. Rest 70% happens informally, one-to-one engagements between individuals. Coming to India, of course, we have a very large population, but then I think our volunteering has not been that great. Socially, culturally, if we see our past, we have very strong and very kind of entrenched, deeply entrenched in our social cultural ethos. Volunteering had been there for many years, right from ancient time. And if you see the history of Indian movements, both in social movement and political movements, volunteers have been one of the key driving forces for bringing social changes in the past. As we know that the spirit of volunteering is in all society, all communities, and India is no exception. And we have very rich tradition of volunteering in India. But again, like we have most of the volunteering takes place under religious and philanthropic domain, which is a very good thing. And this event particularly is very topical or very relevant, that most of the people in the country volunteer to religious organizations and under the guidance and blessings of the religious and faith-based and spiritual leaders. Very recently, if we see the Swachh Bharat mission, or even the Jal Jeevan mission, or even the COVID response, millions of volunteers in the country have been doing wonderful work. However, all said and done, I would like to quote some of the recent data which has come from India, as of course we have very recently the Ministry of Statistics and Program Implementation through the National Statistical Office. They have released the data on unpaid volunteering work in the country for 2019. And this time they call it this time used series, time used by the people. And coming to the free work or unpaid volunteering work, the figures are very dismal. So that's encouraging, and probably all of us have to think about it in the country. And I would like to request all the faith-based leaders to really focus on this. our participation rate is only 2.4% in the country. We are 135 crore population, but in 2019, between January and December, only 2.4% people volunteered for any of the social causes or religious causes even. So, and also like average time is spent by these 2.4% of our population is only 101 minutes in the entire year. So if so that is the kind of data which is coming up from National Statistical Office. And again, like a rural and urban, there is a certain divide. There is more volunteering work being done by urban people than the rural people. And also in terms of male-female participation, there are differences. So if you talk in terms of rural participation, it is 2.4%, out of which male is 2.8 and female is only 2%. And urban, of course, it is 2.3 and 2.5 for the female. So somehow in the urban areas, more women are volunteering than their main counterparts. And average time also there is a bit of difference between male and female and rural and urban. So, but those are the basic statistics. The key point remains that probably we Indians are not volunteering as we have been doing in the past, and there may be n number of reasons, and we know for at least there are certain reasons. We have been working like UNDP and UNICEF, WHO and other even partners have come together during COVID and doing a lot of volunteering work and so promoting volunteering, and UNDP, even volunteers in particular, we are working with the government in 58 districts where we have placed our volunteers. We also have a very huge community of online volunteers who work, and we have a very small presentation which will be made by my colleague after my talk, which will give you a kind of sense that what we are doing in terms of basically promoting health hygiene and hand hygiene, and also relating to COVID and post-COVID and current hand washing, Global Hand Washing Day. But then I think the key takeaway from my side for this event is that we have intent, and that's how this event is happening. And particularly, I think volunteers in India, volunteerism in India have to be promoted by all stakeholders, including the government. And I think religious leaders and spiritual leaders can really help in this effort. We have been working with the Ministry of Youth Affairs and Sports, who are the nodal ministry for youth and volunteering. And there are policy prescriptions being thought about, maybe in the coming months, we'll have a national policy on volunteering. But then policy alone will not help unless we have certain very concrete actions by different stakeholders, including the civil society, private sector, and even partners. But at the end, I would like to say that volunteers could really contribute very significantly. Some of the samples will be presented just after my talk. But then bringing social behavior change in rural area, we have a lot of experience. Last 4 years, we have been working with the rural people, particularly youth groups through the network of youth clubs and Mahila Mandals. And in all these conversation and our work with them, of course, it's a very huge network available in the country. What we find that probably volunteers are not motivated enough, and there are structural issues in terms of incentives, awards, recognition. Of course, a lot of work has happened in Swachh Bharat Mission, and I'm very glad to inform the August audience here that 3 of our districts out of 58 districts got Swachh Bharat awards for 2018 and 2019. And a lot of work happened, and all of you know that how volunteers actually contribute. I'm not talking about even volunteers per se, but the volunteers and their network, both in the government structure and otherwise. But then coming to the hand wash and hand hygiene and other health practices in the post-COVID world, I think we should mobilize more and more volunteers going forward, because I think this is giving a lot of positive results, as we have already heard doctors Saumya, Swaminathan and other colleagues, that how the actions being taken is really helping to reduce other diseases also. Volunteers would be have been creating a lot of awareness and education, particularly, and going home to home and through the clubs and through the youth groups, are doing a lot of motivational and influencing work among the communities. A lot of reinforcement is being done. So like WHO and Ministry of Health and all UN partners have been giving a lot of messages, but then how you reach to the last mile and how you ensure that nobody is left behind. So here I think volunteers have been doing wonderful work all across the country. Really they have been very instrumental in bringing change in the perception and behavior of the people at the grassroots. And I'm mainly talking about the rural hinterland, particularly in very remote districts of the country, where people from the community are really coming forward and participating, not only young people, but even the elderly and adults. And so I think volunteers should be considered as one of the greatest assets for all of us. And I will urge all of you to promote volunteering in whatever way you can do. Thank you very much. Over to Nandini ji.
Thank you so much, Arunji. Yes, absolute. Volunteers are such a crucial and pivotal part of ensuring that these activities and these awareness campaigns actually reach the people. And we really look forward to also seeing how we can partner together with faith-based organizations and interfaith organizations to ensure that we get more volunteers, and not just more volunteers, but volunteers with the spirit of volunteerism to serve their nation, to serve their community. So we look forward to ensuring that this becomes a platform and a way and a moment of us connecting to see how we can ensure that more and more volunteers come forward to serve our nation. And we request Rishi ji from UN Volunteers to share briefly. We are running behind schedule. So if we can have a brief presentation of the work that UN Volunteers is doing in maybe three to 4 minutes, that would be really great, so that we can at least move on to the other sections and in a timely fashion. Rishi ji, if you can, over on to you, if you can do the presentation as quickly as possible so that we can move on with our last speaker.
Thank you, Nandini. And I'm wishing everyone who is present here a very happy Global Hand Washing Day. And with my clean hands, I would like to share what UNV has been doing around promoting hand washing and hand hygiene, especially during this COVID times. UNV India focuses primarily on promoting volunteerism and mobilizing a lot of volunteers. And we understand that our role at utilizing communication for development strategies to bring on-field change. And UNV is present with its online volunteers network with 15,000 plus volunteers. And we have our presence in 58 districts. In those 58 districts, we also have around 8,000 plus youth clubs, which has been created by our UNV DYCs who are present there, who act as the nodal people who take care of youth-related activities. And aligned with that, we create and consist of more than 60,000 volunteers in the district. During the COVID time, there was a huge need to sensitize and aware people, and we've been mobilizing the same to act to bring sensitization among people, especially among young youth. So we organized a lot of workshops on safety and protection from COVID. We sensitized and made aware about hand washing and sensitization. We also engaged our volunteers to amplify and sensitize others using their social media networks. And a lot of our presence in the districts was utilized in a way like we were creating COVID campaigns with the support of multiple organizations, whether it was Sikkim, Bahraich, Kifri in Nagaland. Our presence in aspirational district enabled us to leave no one behind, and we made sure that we utilize as many strategies as possible to engage maximum number of people. With social media interventions also, we engaged our V4 networks, which is the online volunteer, and we engaged them in a concept we call Learn, Act, Engage. We make them learn about things, we sensitize them and build their capacity so that they can amplify our messages, they can take actions further. And as mentioned earlier in the panel itself, simple things are often very critical. So we also made sure that our campaigns help us in promoting simple messages which have big impact. Lastly, I would like to share what we've done. We have organized like more than 3,000, we trained and engaged more than 3,000 volunteers during the COVID time. And we are also running this week the same campaign where we are sensitizing people about the importance of hand washing. We also organized more than 10 sensitization workshops. We had so many actions for our volunteer networks, and we had huge outreach on our social media networks. And at last, I would like to take this opportunity to thank all the volunteers who were supporting us on field, online, and wherever they were, and who supported us in amplifying the messages to hand wash and to protect themselves during the COVID times. So thank you. This is from my end.
Thank you so much, Rishiji. Very nicely summed up in a very few short minutes. And yes, thank you so much for all of the volunteers that have been working with UN volunteers, with all of these organizations to really do the work at grassroots, and also during the COVID pandemic, serving as the frontline workers. So thank you to all of those people who are serving during these difficult times. And with that, we request our last and beautiful, heartfelt welcome to Vinod Mishraji, who has already spoken in the panel and introduced Dr. Swaminathan, but also is now giving his address in the work that WSSCC India is doing to really ensure hand washing reaches the last mile, reaches and touches the most vulnerable and marginalized communities. And Dr. Shri Vinod Mishraji is a beautiful partner and a beautiful champion of women's rights and ensuring that our work together as Global Interfaith WASH Alliance and WSSCC India is really going forward to reach all of those who are usually left behind, but ensuring that nobody is left behind as we move into hand washing and hand hygiene for all. So Shri Vinod Mishraji, without further ado, your address and light on Hand Washing Day. If you can unmute yourself.
Yes, so thank you very much, Nandini ji, for providing me opportunity to speak with the panel, to the audience. I'm grateful to all distinguished speakers of today's webinar on the Global Hand Washing Day. We are convening this webinar in collaboration with Global Interfaith WASH Alliance, UNICEF, UNFPA, UN volunteers, and all respected faith leaders, those who are participating today. My special gratitude to Pujya Swamiji and Sadhviji for their directions and blessings. And it was a great pleasure for all of us to listen to Dr. Saumya Swaminathan, Chief Scientist, WHO. Every year on 15th October, the entire world observed the worldwide through the different celebrations, events, awareness campaign, and advocacy to bring together the individuals, the communities, governments, organizations, community-based organizations to take action needed at every level. And this year theme for the Global Hand Washing Day is to hand hygiene for all. Because of this COVID pandemic, so hand hygiene has become a more important. But if you are talking about the last mile, if you think about the population, those who are living like shanty dwellers, sitting in the slum area in the cities, persons with a disability, and the people, those who are living in the poverty, in the marginalized area, sex workers, transgenders, and the hand washing facilities available at the market, offices, bus stands, railway station, primary health center, and even the places of the worship. It's not very adequate. So we'll have to reach out to these places so that hand washing practice can be adopted universally. Today we have we will listen the all eminent faith leaders and some speaking after us. So I hope the message from this webinar would spread to the masses. Hand washing and face masking and physical distancing. Dr. Saumya explained a lot about how to combat the COVID-19. But hand washing for all people brings enormous benefits. It reduces the spread of different diseases, not only the COVID-19. It helps children to stay in the school. It helps adults to stay in the office, and it generates saving in the health expenditure up to 15 times of the cost. This is the latest study done by the World Bank. But hand washing has basically three components. We'll have to focus on the three components. Without this, we cannot make it universal to all people. First thing that Dr. Saumya also mentioned about the behavior change for the adaptation of the proper hand washing at the critical times, especially before having meals and after defecation. And even it has more become critical during the pandemic time, because touching any surface outside house, you will have to wash your hand. The India has experienced the world's largest behavior change campaign under the leadership of Honorable our Prime Minister, Mr. Narendra Modi ji, in last 5 years, which has resulted in a construction of 110 million household toilets in rural areas in last 5 years. Now, after this campaign from 2nd October 2019, the Government of India has started the new campaign, Swachh Bharat Mission Phase 2 with the ODF Plus, and the focus is hand washing is a part of ODF Plus. So we'll have to create the same type of behavior change campaign, which we experienced in last 5 years on hand washing also. The second component is availability of infrastructure for the hand washing. This is most important, because clean and safe hand washing stations at home and public places is important, and accessibility to the clean running water. This is also very big thing. Yasmin, our colleague from UNICEF, she mentioned on 2nd October even this year, 2020, Honorable Prime Minister has launched a very big campaign under Jal Jeevan Mission to cover the entire schools, all schools and Anganwadi in the country within 100 days with the running pipe water supply. It's a big challenge, and the Ministry of Jal Shakti is working on it, and they are targeting to reach out to the all schools and Anganwadi centers through the functional tap water connection within 100 days. So we'll have to support this campaign. The second thing under Jal Jeevan Mission is the Prime Minister on 2nd October, 15th August 2019, then he launched the Jal Jeevan Mission with the target of Har Ghar Ko Jal. Har Ghar Ko Jal with the functional tap water by 2024. So I hope the both program under Jal Jeevan Mission will be helpful in achieving the target of universal hand washing in India, and this message and learning certainly will go in other countries of the world. Affordability and availability of soap is also a major factor of hand washing. How can we spread the message that washing hand through water is not enough? It should be through the soap, and especially the country like the lower middle income countries, the availability of soap to each household is a very, very critical, and we will have to think from our side as a development partner, as a campaigner, and as a worker, and within the government. The third component of the hand washing, this is not only the availability of water, behavior change for hand washing, but disposal of the grey water. Because if you are washing our hand, this water is going somewhere in the drain. Drain are outside the home. So managing used water safely from the washroom is also critical for the hand washing. So under the grey water management, the government of India has started a capacity building huge program targeting 2,55,000 villages in the country under Swachh Bharat Mission Phase 2 and the Jal Jeevan Mission. This is the great campaign government of India started for the grey water management and used water management. And we will have to support the Jal Jeevan Mission and Swachh Bharat Mission Phase 2 to manage the third part of the hand washing, for the hand washing. This webinar certainly provides a platform to pledge our commitment to work together, to join hands, to ensure that the message and the culture of hand hygiene, the facilities and supplies and services reaches to the most vulnerable and the unreached people to the last mile. Pujya Swamiji has given the commitment by raising hand in the starting. We will have to do the commitment again. India Support Unit WSSC had organized 3-day campaign in the villages of Ranchi in the Jharkhand district for the Global Hand Washing Day campaign in collaboration with the government of Jharkhand. And this campaign generated awareness on the critical times of hand washing and also use of innovative tools and local resources, how to do the hand washing and how to spread the messages. Our state coordinator, Miss Isa Singh, is here, and I would like to request her to please give a brief what we have done the entire campaign in the last 3 days.
Thank you, Vinod sir. Namaste and good afternoon to all, and thank you WSCC and GIWA for giving me this opportunity to share the innovative 3 days campaign organized in the villages of Ranchi district for behavioral change. So I'll just share a PPT. Is it visible to all? Is it visible to all?
Yes, it is. Yes, it is.
Thank you. So before jumping to a campaign, I would like to share a brief introduction about Jharkhand State. According to the census 2011, Jharkhand has population of 32.96 million. The literacy rate is 67.3%, which is below the national average of 74.04%. Scheduled tribe constitute 26.2% of the total population. But when we move to the national sample survey, 76 around 2018, we, according to that data, 10.6% of total population hand wash with soap before meal, out of which only 3.3% of rural population and 32.8% of urban population hand wash with soap. 59.4% of total population hand wash with soap after defecation, out of which 50.6% of rural population and 86.5% of urban population hand wash with soap. If we are talking about hand washing, how can we forget COVID-19 situation? So moving to, I'll just brief the 93,736 people till date are infected with COVID-19 in Jharkhand. And after looking the NSSO data and the current pandemic situation, we are not left out with any option rather than broaden the horizon of innovative and creative campaign design, which can easily communicate the message and help the community to accept the fact. Now we have selected 3 villages, moving to the villages with a different ODF status and socio-economic condition of the village. I'll take you to the Ara village. It is in the Ormanji block of Ranchi district. Ara village is have a sustained ODF status, that is open defecation free status. People are using their toilets, better socio-economic condition, and it is also a drug and alcohol free village. Then moving to the Kukui village, it is a partially sustained ODF status, means some member of the family are still going out for defecation, and even children and elder members of the family. Socioeconomic and overall cleanliness are below average and few left out beneficiaries. Baridi village is not a sustained ODF status, poor socioeconomic and cleanliness status, significant left out beneficiaries. Those toilets are under construction. So we have designed a child-centric hand washing activities designed based on the village condition. Activities focus primarily to engage the children of tribal communities. If children learn good behavior, they sustain this behavior. And we have moving to the activities, we have done focus activities like painting competition, decorating hand washing station. So we see that it is very tough to bring habitual changes among the people, such as adopting toilet usage, and especially among elders and the male members of the family. In this condition, making children and members of the family to understand the importance of hand washing is a tough nut to crack. So in lieu of that, I have specially designed the hand washing based hopscotch game and painting competition of clay and reciting poems and rhymes to engage children. Secondly, like if we see like innovative hand washing, you can see in the picture, like innovative hand washing stations made up of earthen pots with taps were installed in the villages, and they were painted by children to attract their counterpart and the villagers to create awareness. The best part when we get feedback from the villagers after the campaign, and that is that village don't have any hand washing station in the village, but now they have this facility at their public places like public meeting places, temple, and in the Anganwadi centers. So they are thankful to this campaign that it has given them a hand washing station to the villages. Now to the hopscotch game, it brought enthusiastic responses from the children. The format of the game offered fun with knowledge about benefit of hand washing before, during, and after different day-to-day activity. The game has taught them the fact that while not focusing on hand washing, they will not only lose the game, but also the health. And it is being aptly explained by the lines that play is the primary way children were designed to learn. Rhymes and painting competition to engage children below 8 years. Now I will take a minute or two to share the video of a campaign.
Not visible, Isha. Not visible on the screen.
It's not visible?
On the screen, your video is not visible on the screen. I don't know others, but I'm not able to see.
Can anyone else?
Isha, just to put down this presentation, only then can you put the video to us.
You just close this presentation, Isha.
Yes, please.
Then play. Yeah. Yes.
Now we can see it.
I will just take it. Thank you so much. Thank you for giving me opportunity. This is what we have done in Jharkhand.
Thank you so much, Isha ji, for sharing what you've been doing in Jharkhand. And it looks so beautiful to see the children out there. Really beautiful. And we have more of our beautiful videos in this next segment, which is the concluding of the webinar. And we, as Pujya Sadhvi mentioned, and just in terms of actual grassroots work that Global Interfaith WASH Alliance and the Divine Shakti Foundation is doing, we have a short video of women who are making eco-friendly soaps. And if I can request our beautiful tech team led by Dr. Krupali to show the video of our women from Piyusha, who is leading an initiative called Shram and bringing women together, empowering them to have livelihoods. And one of the ways that they are earning livelihoods is making handmade soap, eco-friendly soap. So let's see what they are doing. It seems that the video is kind of down in my screen. I'm not sure if everybody else is. Oh, now it's perfect. Perfect.
जो नेचुरल है, जो पैसे बेच के मिलते हो, घर भी चला सकते हो, बच्चों को पढ़ा सकते हो। मेरे ऊपर प्राउड हो।
मेरा नाम पूजा है और मैं काफ़ी समय से ये सॉप बना रही हूँ। इसमें नेचुरल इंग्रेडिएंट्स यूज़ होते हैं जो आपकी त्वचा के लिए काफ़ी हेल्दी है। तो इसमें जो हम इंग्रेडिएंट्स यूज़ करते हैं वो है बादाम, हल्दी, ओट्स, दाल और बेसन। और इससे आपकी स्किन पे कोई भी रैशेस नहीं पड़ेंगे। और इससे जो इनकम मिलती है इसका यूज़ मैं अपनी स्टडी के लिए करती हूँ, जो मेरे परिवार के इनकम में भी काफ़ी हेल्प करती है। थैंक यू।
Happy Global Hand Washing Day.
Excellent. Nandini ji,
unmute yourself, please. Yes. Unmuted. We have a beautiful video from Ajmer Dargah Sharif of what the children there in Ajmer Dargah have been doing to celebrate hand washing, with a video that Salman Chishti ji had mentioned earlier, and now we get to see them on screen. So the video from Ajmer Dargah.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الصلاة والسلام عليك يا سيد المرسلين ورحمة للعالمين. Greeting of peace, adab, salam, and namaste from Ajmer Dargah Sharif as we come together with a faith-based organization globally to observe the Global Hand Wash Day, not only mark an important day of personal hygiene, but also to show our commitment, our resolve to create an outstanding awareness through the faith perspective, through the worldly perspective, through our engagements with youth, children, women, and elders of our society. From Ajmer Sharif, we have always talked, shared, and propagated the message of spiritual upliftment. And one of the foundation principles of raising your spiritual heights, your station, is to keep yourself hygiene and clean into the best possible manner and the surroundings that you are. One of the 5 basic tenets of Islam, observing regular prayers 5 times daily, is an essential aspect of the 5 pillars of Islam. To prepare yourself for prayers, personal cleanliness is not only essential, but also paramount to worship in Islam. As a Muslim, a follower, a believer, must perform ablution, wuzu, before praying. And there are clear instructions are given in the Quran as to precisely how this should be carried out. Du'as and blessing from Ajmer Sharif. Thank you. We look forward to be together in sharing and learning on 15th of October.
Thank you so much from Ajmer Dargah, the beautiful, beautiful example of how Global Hand Washing Day is being celebrated there with the children and with the faith leaders, and the beautiful message that faith communities have in spreading the message of hand washing. And I actually will request our team to play the one from the banks of Maganga, our Rishi Kumars at Parmarth Niketan, their video next, as how they've been celebrating hand washing with Pujya Swamiji and Sadhviji, learning the 7 steps of hand washing and how they've become ambassadors of hand washing to others. So our beautiful Rishi Kumars from Parmarth Niketan, if we can play what they've been doing at the Gurukul there.
स्वच्छ भारत का इरादा इरादा कर लिया हमने देश से अपने ये वादा कर लिया हमने स्वच्छ भारत का इरादा कर लिया हमने देश से अपने ये वादा कर लिया हमने
स्वच्छ भारत का इरादा कर लिया हमने देश से अपने ये वादा कर लिया हमने
इरादा कर लिया हमने देश से अपने वादा कर लिया हमने
हमसे निकलेगी स्वच्छता की एक नदी चल 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 कल 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 एक धुली सी जिंदगी स्वच्छता की जोत लेकर घर घर जाएंगे साफ सुथरी रोशनी में सब नहाएंगे
स्वच्छ भारत का इरादा कर लिया हमने देश से अपनी ये वादा कर लिया हमने
हर गली अब उन्नति की राह जाएगी आशा की आंगन आंगन गाएगी स्वप्न गांधी जी का अब साकार करना है स्वच्छता का देश में त्योहार करना है खुद से ही करनी होगी शुरुआत बनाएं स्वच्छ भारत साथ साथ
So beautiful to see. It's so beautiful to see what an incredible amount of time and energy has actually gone to train these children, whether it's been at the Ajmer Dargah or here in the Gurukul. They've been practicing hand washing and the 7 steps, and also have become trained to become COVID warriors. As the nation is seeing unlock, how do they maintain a safe and protected and secure ashram environment? So thank you so much for playing these beautiful videos. And in the same line, we've got a message from Kutch, Gujarat, from Sadhvi Shri Shilapiji Maharaj, who is representing and bringing the message from Viratan Foundation in Kutch in Gujarat. Let's hear what Pujya Sadhvi Shri Shilapiji has to say on Global Hand Washing Day. Her audio is not there.
और प्रसन्न मन में अच्छे विचार और अच्छे विचार उत्तम जीवन की नींव है, आधारशिला है। और एक स्वस्थ और स्वच्छ जीवन का प्रारंभ होता है हाथ धोने से, हैंड वॉशिंग से। यूँ तो हाथ धोना, हैंड वॉशिंग एक बहुत साधारण सी छोटी सी बात लगती है, लेकिन वर्ल्ड हेल्थ ऑर्गेनाइजेशन की एक रिपोर्ट के अनुसार दुनिया में कई ऐसी भयानक संक्रामक बीमारियां हैं जो मात्र हाथ न धोने से होती हैं। इसलिए ऐसी भयानक संक्रामक बीमारियों से बचने का एक सरल, एक आसान, एक महत्वपूर्ण और कम खर्चीला तरीका है हैंड वॉशिंग, हाथ धोना। हमें अपने देश को, इस पूरे विश्व को कोविड जैसी महामारियों से बचाना है और यह लोक भागीदारी के बिना संभव नहीं है। इसलिए हमें स्वयं भी जागरूक रहकर हाथ धोने हैं और अपने आसपास में हाथ धोने की इस मुहिम के लिए, हाथ धोने की जागरूकता की इस मुहिम में सबको जोड़ना है, क्योंकि किसी भी देश के स्वस्थ नागरिक उस देश की आधारशिला है, नींव है और उस पे ही बनता है देश का सुंदर भविष्य। इसलिए हमें स्वयं को, इस देश को, पूरे विश्व को बीमारियों से बचाना है। इसलिए आइए हाथ धोने की जागरूकता की इस मुहिम से जुड़कर हम सबके स्वास्थ्य की सुरक्षा की उत्तम कड़ी बने। आपके स्वच्छ हाथों में ही है आपका उत्तम स्वास्थ्य। मात्र 20 सेकंड सही तकनीक से हाथ धोना और स्वयं को रोगों से कोसों दूर रखना। आज ग्लोबल हैंड वॉशिंग डे पर हम प्रार्थना करते हैं कि विश्व का प्रत्येक नागरिक स्वस्थ हो, सजग हो, जागरूक बने और विश्व कल्याण की ओर अग्रसर हो। थैंक यू सो मच। धन्यवाद।
Thank you so much, Pujya Sadhvi Shilapi Ji Maharaj from Kutch, Gujarat. This message from Veeratan Foundation, the Educational Institute, and women and Sadhvijis and the children there also have been practicing hand washing. And sahi mein swachh haathon mein hai uttam swasthya ka shuruaat. So with that, we have a message from our Venerable Bhikkhu Sangasena Ji, who is joining us from Ladakh, from the high Himalayas in Ladakh. And let's hear what he has to say at the Mahabodhi International Meditation Center. Venerable Bhikkhu Sangasena Ji's message.
His Holiness Swami Chidanand Ji Maharaj, the founder of the Interfaith WASH Alliance, and respected Sadhvi Bhagawati Ji, the General Secretary of the Interfaith WASH Alliance, and all the honorable members of the Interfaith WASH Alliance. Firstly, I want to extend warmest greetings to all of you from the coldest land of Ladakh in the Himalaya. As you all know, the world is going through an unprecedented crisis caused by these COVID-19 pandemics. And our country, the second largest population in the world, also have been facing so many problems. So more than 50% of our people in India are not access to proper toilets and hygienic life. So in this regard, under the most dynamic leadership of His Holiness Swami Chidanand Ji Maharaj and respected Sadhvi Bhagawati, the General Secretary, have been contributing tremendously in creating awareness among the people of India and beyond regarding hygienics and many aspects of our life. And today, the World Health Organizations and many others health organizations, individuals have found out the most effective to protect us from the COVID-19 pandemic is to develop hygienic cleanliness. So once again, I think we all have to come together to create awareness among the people, especially in the rural areas, that how to keep our body, particularly hands, cleaned, how to wash the hands regularly, and how to keep the mask continuously, and also to keep distance, social distance. These three steps are the most important thing as health organizations and all the leaders, have been telling. So I want to add one or two more steps to this. Of course, first to put the mask, second to wash hand and keep clean and hygienic, not only hand, everything, the whole body, the house in which we live, the areas, surroundings in which we live, and also keeping distance, social distance. And now I wish to add two more things. Regular yoga practice, regular meditation practice also will help greatly to develop the immune system, not only the physical body, the mind. All these three, what mentioned, the three steps are basically to protect the body. But as you all know, we also have the mind. Mind and body, they depend on each other. It affects each other. So therefore, we also have to learn how to make our mind strong and how to develop the immune systems of the mind, so that, we have a saying, mind over matter. If our body is strong, it also affects, if our mind is strong, it affects the body too. So
thank you so much, Venerable Bhikshu Sangasena ji, who actually wasn't feeling so well. He's not in the best of health, and yet he still sent us this beautiful, beautiful message from Ladakh. And we are so grateful to have Mahabodhi International Meditation Center and our GIWA Ladakh chapter join us in this webinar with this beautiful message of the importance of clean hands and also clean minds, and practicing yoga and meditation to clean our minds. And the last message from our pre-recorded messages for our faith leaders who have celebrated hand washing with us is Sardar Paramjit Chandokji, who's the chairman of the Delhi Gurudwara Bangla Sahib. And he has a short little message on Hand Washing Day. If you can play his message, and then we will conclude this webinar with a beautiful closing remarks by Pujya Sadhvi. Pujya Sadhvi will be joining us for that, and then also a vote of thanks. And Paramjit Chandokji's message from the Delhi Gurudwara Bangla Sahib. No audio.
इस संबंध में गुरुद्वारा बगला साहब का चेयरमैन होने के नाते समस्त देशवासियों से एक प्रार्थना और अपील करता हूं कि आज इस कोरोना के युग में हमें अपनी साफ सफाई का बहुत ध्यान रखना है। खास तौर पे हाथ का धोना सबसे ज़्यादा जरूरी है। और बच्चों के लिए खास गुजारिश करूंगा, दिन में 5-6 बार 20 सेकंड के लिए साबुन से अच्छी तरह हाथ धोएं, और खाना खाने के पहले और खाना खाने के बाद ये आपको हाथ धोनी है। और मैं अपने बुजुर्गों से, अपने नौजवानों से भी ये प्रार्थना करता हूँ कि इस महामारी का कल्याण करने के लिए, इस महामारी को दूर करने के लिए हमारे सफाई की बहुत ज़्यादा ज़रूरत है। सफाई पे ध्यान रखा जाए। आज दुनिया में हम अगर इस बीमारी का मुकाबला कर रहे हैं तो इसलिए कर रहे हैं कि हम अपने आप को स्वच्छ रख रहे हैं। स्वच्छता बहुत ज़रूरी है। और एक बार फिर मैं इस संस्था को बधाई देता हूँ कि उन्होंने इस कोरोना काल में ये जो वीक बना रहे हैं, इस वीक में हम सब लोग मिलकर काम करें और अपने आप को और अपने अड़ोस पड़ोस को बचा सके। इन्हीं शब्दों के साथ मैं अपनी वाणी को विराम देता हूँ। वाहिगुरु जी का खालसा, वाहिगुरु जी की फतेह।
Sat Sri Akal, Sardar Paramjit Chandokji, thank you for such a short and beautiful message. We've actually had a message from the school in Delhi as well that the Gurudwara Bangla Sahib runs, and beautiful message and skit from the children, but it was too long to play on our webinar, and we'll be sharing it on our social media pages. So stay tuned for those messages when we share it all throughout the day today and tomorrow. And all of these beautiful messages, again, will be available on our social media platforms for your dissemination and sharing, and record your messages and share it with us as well. And we'd love to have that featured on our social media. And I'd request with that the closing remarks from the Secretary General of the Global Interfaith WASH Alliance, Dr. Sadhvi Bhagawati, to just shed a light and summarize all of the beautiful messages that we've got during the webinar, and also our continued commitment after this and the way forward. Sadhvi Bhagawati ji.
This webinar has been such an incredible, overflowing experience of wisdom, of inspiration, of innovation, of ideas, of powerful, powerful messages. It definitely does not need to be summarized. We've actually had a full hour extra of inspiration than we had even anticipated. This is what we speak about when we say our cup runneth over. This is really the full experience of so many people from so many sectors coming together with such enthusiasm and commitment and dedication to not just the simple act of hand washing with soap, but all of that which it includes. The human rights aspects, the educational aspects, the aspects with regard to women and girls, childbearing, the aspects with regard to the environment and eco-friendly soaps, the aspects regarding government policy, implementation, advocacy. It's really in and of itself a multifaceted platform and a multifaceted opportunity for us to come together in the name of hand washing, but through hand washing to actually touch upon almost all of the 17 SDGs, because they all are interlinked and interlocked into hand washing so beautifully. So it's a great opportunity to recognize the very individual, very specific, concrete benefits of hand washing itself, the number of people who don't have that access, the ease and importance with which we need to give them that access, but also how through our commitment to hand washing, we actually become really stewards of all of the SDGs. And it's been such a great opportunity to be together. Lastly, I wanted to just give a moment of deep gratitude also to the government of India. Under the incredible leadership and vision and commitment of our Honorable Prime Minister Shri Narendra Modi ji, who created this ministry of Jal Shakti, an entire ministry dedicated to the Shakti of water, how to protect it, how to preserve it. And under the Ministry of Jal Shakti, the Jal Jeevan mission. Because of course we know Jal is Jeevan, water is life. And to be able to work together with a government that is so committed and so dedicated to really ensuring that the people of this nation have access to safe and sufficient water and all of the aspects of hygiene and sanitation that come together when we speak about WASH. So thank you again so much to our beautiful partners at WSSCC, with whom this journey of togetherness has been and continues to be such an unfolding of newer and newer ideas, as of course COVID has created a situation where we had to put on our creative thinking caps of really how do we get these messages out, how do we do advocacy, how do we do behavior change communication in ways that are
I'm
safe,
not sure if it's just from my side, but it seems that
but equally powerful. And thank you so deeply to the WHO, our Dr. Saumya Swaminathanji, to UNICEF, our Dr. Yasmin Ali Haque, to UNFPA, our Argentina Matavel, to the United Nations Volunteer Organization, their representatives, and all of the partners who have come together to make not just the webinar a great success, but actually coming together to work together 365 days a year to bring about health, hygiene, and happiness to the people of India across all races, all religions, all cultures, all colors, and all creeds. So thank you to everyone. And thank you so deeply to Pujya Swamiji for his vision, his guidance, his leadership, his inspiration, his blessings, and through him to all of our renowned faith leaders who have come together today and who keep coming together with us as our Global Interfaith WASH Alliance keeps walking toward bringing about a water secure world for all. Have a beautiful, beautiful, happy Global Hand Washing Day. And we look forward to continuing to come together as we have all of these beautiful opportunities to celebrate these days.
Thank you so much, Sadhvi, and I think she has also done the vote of gratitude, the note of gratitude, and the vote of things all combined into those closing remarks. I think I just had one or two things as we close up, but I wanted to also just check in with WSSCC that if they have any closing remarks they would like to say from their end. It would be great to have that now, and then we just close up the webinar.
So Nandini ji, nothing to say more because Sadhvi ji ने तो सब कुछ कह दिया है और सबके प्रति gratitude और thanks कर दिया है. मुझे आपके लिए कहना है केवल, because we are able to do the entire webinar. I'm seeing you, I mean, since 15-20 days. You are working day and night. So from my side, my team side, from the UNB, UNFPA, WHO, UNICEF, from all of us, I convey my gratitude from entire team to you, and certainly the Pujya Swamiji, the blessing, directions, and respected Sadhvi ji. तो सबसे ज्यादा तो आप और आपकी टीम को मैं धन्यवाद दूंगा. इससे ज्यादा मेरे को कुछ अब कहना नहीं है.
अब मुझे लगता है टीम के आपने कहा वो पूज्य स्वामी जी कहते हैं जलते तेल और बत्ती नाम दिए का होता है, तो जो टीम इसके पीछे आज टेक्निकल सपोर्ट दी है उस टीम को भी
नाम ले लीजिए, नाम ले लीजिए.
तो हमारी शक्ति डॉक्टर कृपाली पटेल जो कि ना केवल सिर्फ डॉक्टर है, शी इज नॉट ओनली अ डॉक्टर बट शी होल्ड्स मल्टीपल हैट्स and is such a beautiful, incredible, divine Shakti. And if it's possible to have her come on screen, that would be amazing. So we can all have her darshan and see her and thank her for making this possible, for making everything possible in terms of the technical support. And I know that she might not necessarily come on screen, but if she does, that would be great. And we can spotlight her, that would be amazing. And all of our incredible Rishi Kumars, the entire technical team behind us. Dr. Kripali, thank you so much for joining us.
Kripali ji, pranam. बहुत बहुत धन्यवाद.
Thank you. And our Rishi Kumars also, if they can come just behind you, Himanshu, Ashish, Shaga, Shubham, Sandeep, Deepak, all of these boys who are really the force, the volunteer spirit that we were speaking about. This is the volunteer spirit. So if we can see them also, that would be amazing.
Yeah, great.
And some in where are the others? Ashish and Himanshu? There we are. And Sandeep ji. And Deepak is around? No, Deepak is not around. But we thank Deepak also. Deepak Sharma, thank you so much. And Sandeep ji, thank you so much. The entire team who makes this possible. These are the volunteers, the sevaks who work day and night and work with their heart and their soul to make this happen. Thank you so, so much. Have a wonderful Global Hand Washing Day. And may you remember hand washing not just today, but every single day. So with that, a very, very happy Global Hand Washing Day. And thank you so much, everyone. WSSCC, GIWA, all of the partners that have joined. Have a wonderful, wonderful rest of the week and the weekend. And Jai Gange, Jai Bharat, Jai Jagat.
Pranam.
Pranam, pranam.